You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families, medical providers, doctors, case managers, social workers, nurses find the right solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when care needs at home have changed. We assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder care process can be, and I wanted to be a guide and a resource for families and professionals. Each week on Navigating Elder Care, we tackle the real questions and challenges that families and providers face during a care transition. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with families, clients, and providers to create a customized care plan. When someone has had a change in health and is needing more assistance after a stroke or a physical decline, such as bathing, dressing, toileting, mobility assistance, we provide them with options such as residential care homes, assisted living communities, memory care communities, or care coming into the home, along with community resources that can support that. We advocate, guide, and educate throughout the entire process of us working with you, the client, your loved one, and your family. Most importantly, we provide ongoing solutions and support. You can reach me at 210-669-2222 for a free consultation. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome back to Navigating Elder Care. I am your host, Laura Daniels, and in today's episode, we're going to discuss what we at Care Advocates, what we do and how we guide families through one of the hardest decisions, and that is moving someone into care or just accessing care and what those options are. Why does navigating elder care feel so overwhelming? And that's because it is. If you have a loved one that has had a change in health, a physical decline, if you are listening right now while you're juggling that decline, that next doctor's appointment, phone calls, family opinions, and that constant knot in your stomach, this episode is for you. This is a very difficult transition, very difficult decisions, and it feels hard because it really is. Families are thrown into this with no warning. No one plans elder care the way that they plan for child care or for a savings account or for retirement. Most families are dealing with a fall, stroke, dementia, diagnosis, or a hospital discharge all of a sudden, and most families enter into this during a crisis. People do not start this journey calmly. They begin scared because they do not know what the next steps are. And all of a sudden, everyone becomes an expert. Mom fell, and everyone has a story, and most of those stories are not even relevant. Siblings, neighbors, coworkers, Google, Facebook groups, everything is so confusing. And if you are feeling overwhelmed, it's because it is overwhelming. There is really no roadmap, no handbook, no timeline, no clear starting point. You are expected to make life-changing decisions immediately, sometimes without any advocacy or a guide. There is so much information, no true clarity at times. There's Google overload. There's conflicting advice when you start reading. And this can be very overwhelming. Our system is truly fragmented. The healthcare system is not built for families. Hospitals move very, very quickly. Rehabilitation focuses on short-term progress. Everyone is short-staffed and with very little time to explain every detail. Hospital rehabilitation, long-term care, the system is not designed to be simple. It can be very complicated. And families are pretty much left alone for them to connect all of the dots. And that's where we come in and just finding what the next steps are and assisting you with all the care options and all the answers that you need. So what happens when your loved one is no longer able to live alone? One of the hardest decisions that families face is knowing when the time is for them to seek care for a loved one or for themselves. Often that moment comes when they are no longer able to safely or consistently care for themselves, when a caregiver's emotional, physical, and practical capacity has been reached. Signs that care may be needed include a decline in physical health or cognitive abilities, increased safety risks such as wandering, falls, noticeable strain on the caregiver's own health and well-being. Seeking care is not giving up. It is choosing dignity and support for you and your loved one. Deciding when the right time is to move a loved one into care or to simply start accessing care at home is one of the most emotional and difficult crossroads a family can face. It's not just about the logistics of that decision. It's a heart decision, H-E-A-R-T, a heart decision. It often comes with layers of love, guilt, hope, fear, and uncertainty. And many families struggle because there's rarely a single clear moment. Instead, there's a lot of small little signs that begin to add up. For example, I got a call from a client this morning who was issued a notice of Medicare Non-Coverage, and that's pretty much a letter saying that they have to leave a skilled nursing facility within days. And, mom had a stroke. She hasn't planned for anything. She has been given a discharge date of possibly Friday. So at this moment, she's trying to figure out what the next steps are. And of course, mom isn't able to go home, so we are going to provide her with care options that are going to assist mom with all of her care needs: bathing, dressing, toileting, meals, housekeeping, etc. So again, this is one of those situations where things become a crisis and things are not planned. So this daughter is left with just 4 days to make a big decision for her mom's care. The time to explore care options is often when your loved one can no longer consistently or safely care for themselves, or when the caregiver demands begin to exceed what one person or family can reasonably provide. And when it comes to accessing care or seeking care, 90% of the calls that we get are like the example I just gave you. It comes within a crisis, right? They're being issued a discharge letter. They only have a few days to make a decision, or mom fell and fractured her hip, or dad wandered out the door. So it's good to plan ahead and just to really explore what the options are and not have to do this in the moment of crisis. Key indicators that somebody may need care may include increasing confusion, memory loss, frequent falls, missed medication, changes in hygiene, wandering, or emotional and physical exhaustion for the caregiver that's caring for a loved one. Equally important is recognizing your capacity as a caregiver when it's reached its limits. Caregiver burnout is real when caregiving begins to affect your health, your relationships, sleep, emotions, or work, and it is no longer sustainable or safe. It's for either you or your loved one that you're caring for. Know that seeking care, seeking possible placement to an assisted living community, memory care community, does not mean that you are giving up. It doesn't mean that you love them any less. It means that you want them to be supported, dignified, and safe. And you also want to maintain that relationship that you have. Instead of being the caregiver, the cook, the nurse, everything else, you don't want to lose yourself trying to meet needs now that require more than one person. You always want to remain that family member, that daughter, that spouse. Moving a loved one into care can be a huge turning point, one filled with relief, stability, and renewed connection. It allows families to shift from doing everything to just being present, engaged, and emotionally available. And once again, being that daughter or that spouse, just the family when you visit. Choosing care is not the end of your role. It is simply the beginning of a new chapter where love continues, just support it in a different way. we're going to take a closer look, and expand on 3 signs and patterns that can help you determine when it may be an appropriate time to transition your loved one into care. And these include, number 1, safety and the ability to self-care; 2, cognitive and emotional changes; and 3, caregiver burnout. So let's look at these 3 closely. When we talk about safety and the ability to self-care, your loved one, does your loved one have difficulty with daily tasks? Are they struggling with bathing, dressing, eating, or just using the bathroom, needing more assistance on a daily basis with their activities of daily living? These can be signs that it's time to transition your loved one into care or bring care into the home. Safety concerns: are they having multiple falls? Are they forgetting to take their medication? Are they not able to manage chronic health conditions? Are they neglecting their own personal hygiene? Also, looking at the home, are they unable to keep up with household chores? Is the home no longer safe or suitable for their needs? One of the biggest signs that we see is when families are visiting during the holidays, and you visit your mom and dad, and you find that there are stacks and stacks of mail, or the refrigerator is either full or empty, expired food, clutter. So all of those are signs that perhaps they're needing assistance. Another one is cognitive and emotional changes. So we've talked about safety and the ability to self-care. Now let's go into cognitive and emotional changes. When we talk about that, we're talking about memory loss and confusion. Are they experiencing confusion about time, place, or other people, which can lead to missed meals, missed appointments, forgetting to take their medication, forgetting to hydrate? You also see social withdrawal with this. Are they losing interest in hobbies, friends? Are they becoming more isolated, more depressed? Changes in behavior. Are they experiencing mood swings or changes in behavior, particularly if you have seen a progressive condition like dementia? Is that getting worse? The third, and probably the most important one, is a caregiver burnout. Your own well-being. If you are experiencing severe burnout, stress, fatigue, that can make it difficult to provide consistent quality care. How do you care for someone when you are not able to truly care for yourself? That's very important. The inability to provide the needed support, your own home environment, your own personal obligations, your schedule may not equip you to provide the level of care that your mom or your spouse requires. It's very overwhelming, and caregiver burnout is very real. The next steps that we talk about is really deciding on care and planning. You need to observe and document. It's important to really keep track of what's going on, behaviors, including incidents that may happen. Another important thing to do in next steps is consulting a professional. Talk to your loved one's doctor or geriatric specialist for a comprehensive medical and cognitive assessment. Their professional recommendation can provide you objective insights, and it will even validate what you are thinking, right? So that you're not that person that's presenting the information to mom or dad. If you have a medical doctor presented, they seem to take it better, right? It's someone of authority. Just if they're not able to safely stay home, those recommendations can come from your family doctor. Discussing it as a family. Include your mom, your family, your dad in the conversation as much as possible, focusing on their needs, their preferences, and most importantly, safety. It's important to frame the move as a way to enhance their quality of life and allow you to focus on you being their loved one rather than the full-time caregiver or part-time caregiver. Exploring options. Researching what the different types of care facilities are is important. Doing your homework before a crisis happens, knowing what options are available out there, such as residential care homes, assisted living communities, memory care communities, and taking tours of these places, really looking to see what the cost is, the staffing ratio, where you think mom or dad would be a better fit in these places. There's also other options, such as respite stays. That's another option. A trial assisted living respite is a good option, just to try something for a few weeks. If you need a break or someone's leaving on vacation or having surgery, having your loved one do a short-term stay can be a good way to try out assisted living. Temporary in-home care can also be another option. Bringing in hourly caregivers into the home is another way to explore these care options without making it so final. It's just temporary. It's a trial. We're going to see how this goes. Planning ahead. It is better to plan the move and the care proactively before a crisis occurs, as emergency placements can be more stressful for everyone involved. And as I've said before, 90% of all the placements we do happen immediately. We get calls from hospitals, rehabs, mom's being discharged on Friday, Dad Phil broke a hip, he can't go back home, I need to find something now. So it's becomes very stressful, and it's great to have a plan of what the care is going to look like. What type of care does your loved one want before a crisis occurs? So mom fell, or dad had a stroke, or you have to make an immediate decision, or you just simply want to plan ahead. Have you ever wondered where to start when thinking about finding care for your loved one, whether it's tomorrow or in a few months? When thinking about care options, you can always call me. My number is 210-669-2222. I am a national certified placement agent. I'm a registered nurse. I've been a nurse in the geriatric space for over 32 years. I can help you walk through every step that you will need in finding care options, whether it's tomorrow or planning ahead a year from now. I will walk you through what our referral process looks like next, and how we help families, and why no one should ever have to navigate senior care alone, especially during a crisis or in any situation. There are there's over 100 options out there, and just in San Antonio alone, and finding the right care option is very different it's very unique for every individual. It's based on budget, location, care needs, unique situation. There's so many preferences. We take all of that into consideration. So many families come to us overwhelmed and unsure of what to do after a hospital stay, a fall, or a diagnosis. Sometimes they have a day or a few days or even hours to plan what is next regarding care. Our job is to guide them through every step, from understanding the care needs to identifying what their budget is and location preferences, to looking at all these care options, going with them to tour all of the care options that we provide to them, and finally helping them transition safely into the right environment. And again, that can be care outside of the home, such as a residential care home, an assisted living community, memory care community, or it can be bringing trusted resources into the home, such as in-home care, physical therapy, occupational therapy, mental health. We can bring in visiting practitioners, hospice, caregivers into the home. Know that our services are at no cost to families. You can call us. We can go meet you at bedside, do a free consultation, go over all the options. We can provide you with many Medicare covered resources as well. So when we talk about information, you deserve clear information and someone who will walk beside you through every step of your care transition. Have you ever wondered where to start when thinking about care for your loved one? Navigating senior care is very complex and emotional. It's a huge decision. Most families do not know the difference between what an assisted living community is versus memory care versus skilled nursing, residential care home. They do not know what home care is versus home health versus hospice. It's all very confusing. Families are often overwhelmed, exhausted, or in a crisis. And what we do is we eliminate that confusion by providing clarity, options, education, support, advocacy. We give you all of the information to make the right decisions for your loved one. Most families do not plan for this stage of life. It often happens gradually and then all at once. When that moment arrives, it can feel overwhelming. And there are emotions, questions, fears, and the weight of wanting to make the very best decision for your loved one or your spouse. That's where we come in to assist you. We understand the care system. We know the available options. We know the emotional weight behind making these decisions. Families need to feel supported. We are a team of nurses, social workers, certified dementia practitioners. We are national placement specialists. But beyond our titles, we are people who have walked this journey with hundreds and thousands of families, and in many cases, and I can say this, our own families. We understand both the care system and the human side of these big decisions. But most importantly, we are advocates who understand clinically and emotionally what your loved one needs. Our role is to carefully guide you, support you, and match your loved one with the most appropriate and safest care setting. We take the time to understand who your loved one is, their medical needs, their personality, their routines, what brings them joy, comfort, and dignity, not just for the loved one that you're placing, but we also consider what you're going through and what your wishes are. Know that we are partnered up with hundreds of trusted care options, including assisted living facilities, memory care communities, residential care homes. We work with a lot of services that come into the home as well. Each one is vetted to ensure safety, dignity, and compassionate care. Know that you don't have to walk this alone. We walk this journey with you every step of the way. You do not have to do this by yourself. We walk beside you step by step until you feel peace, clarity, and confidence in the decision that you are making. And this journey can take 4 hours. Sometimes it takes years. We work with clients over a few years that are not ready to make a move, but they keep in touch with us. We keep in touch with them until they're ready to either place their loved one into a memory care or bringing care into the home. When families come to me, they often say, I don't know where to start. And what I tell them is you don't have to do this alone. We do this every day. From the moment we connect with you, your journey becomes our journey. I walk this with you. I listen to your fears, your hopes, your questions, and help you make decisions that feel thoughtful, supported, and right for your loved one. This part of the journey doesn't end once we find placement or bring care into the home. That's where a new phase of support begins. After a family chooses a care setting, we stay connected because we want to make sure that the transition feels right, that the care setting is meeting the expectations, and that your loved one is adjusting comfortably. We check on you the first 48 hours, then 1 week after, and 1 month after that, and as needed. Know that we are always here for you as a resource to provide education, advocacy, and support. Navigating elder care can feel overwhelming because it's unfamiliar, emotional, and complex, but it becomes simpler when you slow down and focus on what truly matters and stop trying to do it all by yourself. Give us a call. We can help you with these hard decisions and all of the care options out there that can be so confusing and overwhelming. When your loved one has real care needs, the solution is not doing more. It is doing what is sustainable, safe, and respectful. And you are allowed to choose help and to get assistance to be able to make these hard next steps, hard decisions. If you or someone you know is feeling overwhelmed and needs support in finding care for your loved one, you can reach me directly or call Care Advocates at 210-669-2222. I thank you for joining me on Navigating Elder Care, where we bring guidance and answers to every step of the elder care journey. If you are a family member, hospital case manager, or healthcare provider, and you know someone facing a change in health, or planning for a future care need, Care Advocates is here to help you find the right care at the right time, whether it is assisted living, memory care, or bringing trusted resources into your home. We walk alongside you every step of the way. Our commitment is simple: care, compassion, lifetime support. For a free consultation, call me at 210-669-2222. Be sure to subscribe, like, and share our podcast, and visit us at advocatern.com for helpful resources. You can listen to past episodes on YouTube or listen on your favorite podcast application. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Elder Care, where we help you find the right care at the right time for the people that matter the most. Thank you for listening.
This has been Navigating Elder Care with Laura Daniels, providing guidance and answers for every step of the elder care journey. For a free consultation, call 210-669-2222 or email Laura at advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.